for next protocol given by Dr. Tan, that is very famous protocol for frozen shoulder. Frozen shoulder. He has applied for shoulder pain, pain of the scapula, pain of the collarbone. Even this pain is referring to the arm. And we also tell trapezius muscles pain. Okay, pain referring from scapula to arm, pain referring from neck to shoulder joint. It may be periarthritis of shoulder joint or frozen shoulder or bursitis. Any problem in the shoulder region can be rectified from next formula. Whenever you treat the shoulder pain, especially for females, ask them one thing. Many female what doing, they are taking the bath and after that they are not drying their hairs and their hair touching the back. So their hair touching the back region like this. Okay. So this part is little wet and damp for some time, and slowly with the time they develop shoulder pain. So it is compulsory to dry the hair after taking bath, even having small hair. Otherwise, slowly this part will be very painful. So the pain in the shoulder joint is very common in the male female both, but very common in the female, even in the young age. And shoulder pain is very common, like frozen shoulder is very common in the diabetic person. So if someone is suffering from the diabetes, he will take little more time for getting complete cure. But some other person is not diabetic, he will get faster relief. So whenever any patient coming to the doctor with a complaint of frozen shoulder, if he is 35, 40 years or 45 years or more than that, so doctor is checking sugar level also, because many times frozen shoulder because of the shoulder problem, because of the sugar imbalance. As per the acupuncture, right-sided frozen shoulder may be because of the liver problem or gallbladder problem or uterine fibroid. So many patients suffering with the uterus problem, uterine fibroid, chocolate cyst or ovarian cyst, even problem in the ovary. So energy, as per the energy concept, it affects their right-sided shoulder joint. So if someone is suffering from the right-sided shoulder joint, kindly check their right cheek pulse, because we know right cheek pulse showing the condition of reproductive part. Or if you don't want to check the pulse, just tell the patient and ask the history of periods and condition of ovary, And if you feel little bit confused, and then also you can ask the patient to go for sonography. And when patient is suffering with the left-sided shoulder pain, this may be because of the heart, the decreased blood supply of the heart. So many times heart is getting decreased blood supply, and this is creating the shoulder pain. And sometimes because of the cervical spondylosis, patient may suffer with the pain any side in the shoulder region. So first we have to rectify the condition. What is the root cause of the shoulder pain? But as per the Dr. 10, there is a fixed formula has been provided for the shoulder pain. So we can apply this directly. So look at here, if this is the arm, so this is the shoulder joint, this is the elbow joint, and this is the wrist joint. So if shoulder joint is representing uppermost part and wrist joint is representing, and after that, after wrist also be a finger. So if we do the imagination of whole body here in the shoulder joint, then shoulder joint is representing uppermost body part, because this is representing uppermost body part, and we know when we are standing erect, then this is the uppermost body part. This we tell Sahasrara Chakra or DU20 point. So that's why putting the needle in the DU20 point is one of the good idea for the relieving shoulder pain. Even you can apply one powder given in the Ayurveda. The name of this powder is Rashanadi powder. This powder is killing the vata and very good for the painful disorders. Even we can ask to patient to drink Maharashanadi Kada 20 ml twice a day, mixing with the water in the equal quantity before meal. So there are many medicine, and this is the one of the safest medicine, but just Rashnadi powder can be applied on the top of the head, and it is very effective for the frozen shoulder, because this is the top of the shoulder and representing the top of the arm, which is shoulder. Also, we can do some acupressure here on the top of the head. Just doing the stretching and reflexology and acupressure also may give good result. If we see any bones, so bones, any bone, like this upper part of the bone is showing upper part of the body, and lower part of the bone is showing lower part of the body. So let's say this is the arm, and we have metacarpal bone here. So we have metacarpal bone 1, 2, 3, 4, and 5. These are the metacarpal bones. 1 to 5. 1, 2, 3, 4, 5. And each and every bone representing full body, and uppermost part showing the representing our shoulder region. So if we put the needle in the uppermost part of this bone, we can rectify the problem of the shoulder joint. So in this way, we know SI3, TW3, and LI3, these 2-point location. Look at here. So look at the location of LI3. It is just starting off metacarpal bone, LI3. So it is showing the uppermost part of the body, so uppermost part of the shoulder. So Li3 is very good point for the shoulder pain. In the same way, the Si3 point also we can see here. So look at here, Si3 point. We can see this is the long metacarpal bone, and we can see the Si3 location. It is in the uppermost part of the bone. It is also showing uppermost part region or shoulder region. And we know the location of Si3 is on the side. Here you can see very clearly. Actually, is the image, it is given in the lower side, but it is very near to this crease, heart crease. So Chinese people, what they are doing, they are taking one hanky, making two knots, one knot keeping on the Li3, another knot keeping on the Si3, and tidying it very like tightly. And this hanky is very good to remove the pain from the shoulder joint. And remember one thing, Si3 and Li3 we are applying on the same side of shoulder pain. So if someone is suffering with the problem of the shoulder pain the right side, so we should apply Li3 plus Si3 on the same side. We have three yang meridian in the arm. So let's see the triple Burma 3. This triple Burma 3 location also can be seen in the starting of the bones. So all the three yang meridian we can put here in this way. So Li, Si3, Tw3 and Li3, these 3 points are very effective for the shoulder pain. Because if shoulder pain in the front side, then it can be rectified from the Li3. If it in the back side, then it can be rectified from the Si3. But if it is in the lateral side, neither front nor back, so it can be rectified from the Tw3. So with the help of these three meridians, we can rectify the shoulder pain either in the front side or back side or in between. These 3 points is also very much enough. No need to take any extra point many times for the treatment of frozen shoulder. Why these 3 points are very much enough? Because all the 3 points, look at here. This is the Li meridian. This is the triple Burma meridian, and this is the Si meridian. And each in every meridian we have 5 points. First point is called Jingbei point. Second point is called Ying Spring point. Third is point called Stream point. Fourth is Jing River, and fifth is Hisi. And we know the third point or Su Stream point having the capacity and power to rectify all the problem in any meridian. So we talk about the Li meridian, Li3. If we talk about triple Burma meridian, triple Burma 3. If we talk about Si meridian, Si3 are the third number point or Su Stream point. So whenever we put these 3 points, Si3, Tw3, Li3, all the 3 points are Su Stream point. So they can rectify any problem happening in the Li meridian, Tw meridian, Si or Si meridian. So they can rectify front shoulder pain, back shoulder pain, or lateral shoulder pain. Let's proceed and see the idea of Dr. Tan. So Dr. Tan has taken Si3, Tw3, and Li3 on one side. Then he has taken pericardium 6, lung 8, and heart 5 on the other side. As per the Dr. Tan, because this pain many times is because of the neck pain or cervical spondylosis. These 3 points, pericardium 6, lung 8, and heart 5 are very effective for treating the nerve coming from the cervical region and passing through the shoulder region. So we know this is the arm. If this is the arm, and if we imagine the full body here, so this is the eye, this is the mouth, and this is the neck region. So in this way, we find these points, heart 5 here, pericardium 6 here, and LU8 here. So all the 3 points are treating any problem which is in the neck region. So this frozen shoulder protocol is very effective if someone is suffering with the cervical spondylosis. So this protocol is not only treating the frozen shoulder, but it is also treating the problem of the cervical. So in this way, we will see here also, look at here. You can see here the location of lung 8 is just near the wrist. It is just 1 chin up or proximal from the wrist, 1 chin proximal from the LU9. So lung 8 is a very good point, and it is a river point which is rectifying all the problem of the shoulder region, which is rectifying all the problem of the neck region. Let's see the location of heart 5. So look at here, heart 5 is also just 2 finger away or proximal from the wrist. Let's see the location of pericardium 6. Pericardium 6 is 3 finger up from the wrist crease. 3 finger. So in this way, these all 3 points is near to wrist or little up from the wrist. So if we see the wrist here, this is the thumb this side. Towards the thumb we have lung 8. Opposite side from the thumb we have heart 5, and in between we have pericardium 6. And also when we are making the global balance, so first we took these points, SI3, TW3 and LI3. On the other side we have taken pericardium 6, lung 8 and heart 5. So look at here, we are proceeding in the cylinder proximally. So like this is the cylinder of meridian, and this is the arm and finger. So first we have taken the point here, Li3, Si3, these all points. Then we have taken these points here in this part. So I will show you what I'm going to tell you. Suppose this is your arm. So first we have taken the point here in this part. Then this on one side. Then in the next step, we have taken point near the wrist. So we are just following we are following this, the shoestring point. Then we put the next, that is river point. So one side we have put the shoestring point like SI3, LI3 and TW3. And after shoestring point, we have taken the point that is a river point. So we have taken pericardium, we have taken our lung 8, heart 5 and pericardium 6. Actually heart 4 and heart 5 is very near, and pericardium 5 and pericardium 6 is very near. Dr. Tan has taken these 2 points, heart 5 and pericardium 6. Then we will proceed again little further. So look at the image of leg. So this is the hip joint. This is the knee joint. This is the ankle joint. and this is the feet. So in the first step, we have taken the, now this is the third step. So we will go little in the between because we are going first point here, second point here, third point here, and fourth point here. So 1, 2, 3, and 4. So first and second step completed. Now we are moving up. So when we are moving up, so we are coming in the, so but this is the ankle joint. So from here we are, and this is the feet. So we are moving up and we are taking point some here. So we are taking here stomach 38. So if suppose this is the leg and this is the stomach meridian because this is the knee and this is the ankle, and the total length of this leg is 16 chun, and just center point on the location of 8 chun is stomach 38. So now we have taken stomach 38, we have taken gallbladder 37, and we have taken bladder 58. These points are little up. So we have made the formula in this way. SI3, TW3, and LI3. Then pericardium 6, heart 5, and LU8. Then we took here stomach 38, gallbladder 37, and bladder 58. Stomach 38 has been considered as a magic point of shoulder pain. GB37 is very good for the neck pain, and even UV58 is very good for the neck and shoulder pain. At last, we will take here HISI point. So this will be the liver 8, spleen 9, and kidney 10. Because as per the half Tai Chi, because this is the knee joint and this is the ankle joint. As per the half Tai Chi, this area belongs to the whole body and knee joint becomes shoulder joint. So in the knee joint, we have taken these 3 points, liver 8, spleen 9, and kidney 10. So finally, this formula is ready for the frozen shoulder. SI3, TW3, LI3, pericardium 6, heart 5, and LU8, stomach 38, GV37, and bladder 58, liver 8, spleen 9, and kidney 10. Spleen 9 sometimes alone point is enough to clear the frozen shoulder. So this is a very wonderful protocol for the frozen shoulder because of any reason, any cause. So enough for today. Thank you so much.